All right, everyone. So welcome to our third STEMathonX workshop today. Today we're joined with the physician assistant, Dr. Claire. Dr. Claire, do you want to introduce yourself to the audience?
Sure. Hi, my name's Claire Rye, and actually, people just usually call us by our first names, not doctor, because we're not. And they have just voted to change physician assistants to be called physician associates. So thank you so much for having me. It's a pleasure.
Yeah, we're super excited to have you here too. We've had a handful of really interesting workshops, and we know for a fact that this is going to be the next one in the chain. So let's get started with our first question. So a lot of us are familiar about physicians and other sorts of primary healthcare doctors, but I'm sure not many people here know that a physician assistant is also a type of primary healthcare doctor. So could you kind of get into what a physician assistant does and what their role is?
Sure. So a physician assistant, when I went to school, you needed an associate's degree, but I had a bachelor's and then I got my master's. So now to be admitted, you need a bachelor's degree and then you would graduate with a master's degree. And you work alongside a physician. They don't have to be there with you, but you have to have a physician that you work under. And we can do whatever that physician does. Whatever their skill set is, we can do the same as long as they feel comfortable and we feel comfortable doing it. So I graduated from Duke University in 1991. So I've been a PA for a long time. And with PAs, you can be, you don't have to necessarily specialize like you do if you're a doctor. So as a physician, you would go to school and you could specialize, say, in dermatology. But if in 4 years you don't want to do dermatology anymore, it's very difficult to switch if you're a physician. So as a PA, I've worked in multiple different specialties, and that's one of the things I'm really lucky to be able to do. I think, that's kind of the general gist of being a PA. We can write prescriptions, we can do procedures. If you work for a surgeon, you can work in the OR. If you're a dermatologist, you do dermatology procedures. It's whatever your physician wants to train you in and you feel comfortable with.
Yeah, that sounds amazing. So you mentioned that you work in all sorts of like subfields in the medical field, and that's what's so cool about being a physician assistant is that you don't have to commit to something. So could you kind of get into what fields possibly that you've worked in, which ones you had a great time in, which ones not so much, which ones you prefer, all of that?
I can definitely do that. So the other thing is, PA school is 2 years, and you can go and do another year after that if you wanted to. So that's another big difference between a PA and a physician, because a doctor is 4 years and then they have to do the residency. So I have worked in a fair amount of specialties and primary care. So primary care was kind of been my main staple, but I have worked in endocrinology, I've worked in dermatology, I've worked in the ER, I worked in GI, and I'm currently working with a geriatrician in a nursing home. And I would say this is my favorite job, actually. So many interesting patients. And I guess my most challenging one was the emergency department. And that one, it was challenging for me. But some people love it. So, it's just a personal preference, and you may take you a while to find your dream job.
So the experience working in so many different parts of like the medical field, do you have any special moments or like interesting moments that happened in the ER or any of your fields in general?
Oh my gosh, the nursing home is probably the most interesting. So right now I work for Santa Clara County, and we contract out beds at the nursing home for patients that have no other nursing home will take them for multiple reasons. And so you can imagine those patients they're medically usually very complicated and socially very complicated. And I mean, we just see the most unusual things there. I mean, we have a lady who has a benign lesion in her gums who bleeds intermittently, and we got a blood count and her hemoglobin was 3.7. I mean, normal for a female is like 12. I've never ever seen anything that low. I mean, it's just all the things that we see, and it's interesting, and it's just very rewarding. I really like this job. But I've also worked in the doctor's offices, it's different. You have your appointments and you come in and you see your patients, and it's very, very regimented. And then this particular job and the ER, there's no appointments. It's just kind of as things come at you, you take care of them. I
So you
actually work with
sorry, go ahead.
I'm sorry. Yep. I work with a social worker and a physician in our group. So we kind of work as a team, which is probably my preferred way.
So you talked about working in a nursing home, and especially those medical workers and first responders have been hit the hardest by the pandemic. So how has COVID-19 affected your job in general?
So it was, the nursing home was really hit hard, and ours too. And our county was hit hard, and it actually, we had a pop-up hospital because the hospital had so many COVID patients that they couldn't handle them. And they had myself and one of the other doctors that I work with at the nursing home. We went and helped we helped set up, a lot of other people did it too, but we helped set up the pop-up hospital there. So, that was quite an interesting journey that we had there. The other, I know you have more questions. I just wanted to kind of go over a little bit more. I was thinking one of the things for PAs, as I said, is you have to work under a physician, but they don't physically have to be on premise. You just have to have them available by phone. So I worked in a primary care doctor's office. I was there by myself every afternoon, but if I needed his help, he was always available to, talk me through things. So there's a lot of autonomy, or you can work in a situation where there's always a physician around. It just depends on your what job you get.
Yeah, that's really cool. So, just based upon all of what you just said right now, I did a little research a little prior to this workshop, and it's been a pretty common consensus that the physician's assistant is like the #1 most satisfying job in the medical field. Would you agree with that, or what are your thoughts on that take?
I mean, it's been great for me. I've really enjoyed it. I mean, I think, when you're thinking about your future, you have to think of, one, you want to be able to make a living, and two, you want to be enjoy going to work every day. And so to find something that both meets both of those, and being a physician assistant's been, I think the pay is definitely good, and I've enjoyed it. So I think when you're looking, you have to try to sort out what you want. And I think before you do that, some exposure to some type of medical or patients or something like that helps. I mean, I shadowed students or people that were interested in going to PA school, and they've been like pharmacy techs or CNAs. So to have some type of idea of what you're getting into, if you're really going to like it. And for the PA, like where I've worked before, we're supposed to be we're supposed to take the load off the doctors, basically. And so in the situations I've been in, there's a lot of patient interaction. So, if you like interacting with people, I think it's a really great profession. The only one thing is, if you feel like you want to be in charge and you want to make all the calls, it's probably better that you go to medical school, because you're working under the physician. So, if they're saying, I mean, obviously, if they go say, do something that you think's obviously terrible, you wouldn't do that. But, you ask and you follow pretty much what you both have decided would be the recommended course of treatment for the patient.
Yeah, so you mentioned earlier that communication is a big part of your job. If you love communicating, then you'd probably be great at being a physician's assistant. But we know that not every patient, especially the ones you mentioned a little bit earlier in the nursing homes who might have social problems or medical problems or something of that sense, would have a hard time understanding whether if your treatment is correct or as any medical term which you're bringing in. So how do you, communicate and build trust with patients who you work with?
Time, taking your time, being patient, and reinforcement. So, I think somebody told me it takes about hearing something 3 times before you actually get it. So, you can't get frustrated when people don't remember, don't understand. And I think it's just repetition, being patient. And sometimes you have to change, if you can see that you're not clicking, maybe you need to change the direction you're going, or explain it in a different way. But I always try to explain it in terms that they understand, so that, when you're talking about blood pressure, I always use like a hose, think of a hose. It's the things that people understand. And it takes time. Time is probably the biggest thing that helps us, get across to patients.
Yeah, so like we were talking about earlier, physician assistants are one of the most like satisfactory jobs, or people are usually satisfied with their jobs, and there's a lot less stress than maybe like a surgeon. So as this field is rapidly growing and occupations with many more people in the future, where do you see like the importance of PAs in like the near future?
Well, I think they also are predicting a shortage of physicians in the future. So I think that's where the PAs are going to be helping take some of the load off the doctors, especially the primary care doctors. They're busy, and if you can help them. And basically, physician assistants are, the general initial concept was that you would help take care of patients that, are kind of the run of the mill in primary care anyway, and do the things to help free the doctors up to do the more complicated things. So, I would do a lot of physical exams, and, the easy visits in primary care, the common issues that they come in with. The very complicated patients, then I do always consult the doctor.
Yeah, I definitely agree. It's really important to like keep balance in both sides of these things. And talking about opportunities in the future, what would you encourage the audience to partake in to pursue like a path into the medical field?
As before, I think you should expose yourself to something, some type of medical situation. They have scribes sometimes. That's a great thing. Volunteering, I know, is what some people do, but just kind of get your feet wet a little bit and see if it's something that you like to do. And if you like people, that helps.
Yeah. It seems like a lot of the jobs in the medical field involve people or working with other people. And you said that you like working in teams as well. So whenever you have a team meeting or whenever you're just working in a team, could you kind of explain how that process goes down?
Yeah, so we have weekly team meetings, and we will obviously we have an agenda, and one of them is like our discharge planning. So we just, as a team, and it's myself, the doctor, we have a social worker and a LVN, and we talk about, how the patients are doing, what we think the discharge date will be, what they're going to need. We follow them after they leave the nursing home. Do they need a primary care doctor? So we kind of have our own agenda, and we all feel very comfortable in our team saying what our opinion is. And we listen to, we throw around ideas and we come up with ideas. And I think if you feel comfortable and you have a good team, that's the way it should work.
Yeah, teamwork makes the dream work, you know what they say. Yeah, so now that we know a lot about your profession, how you work in teams and the type of people you work with, let's tie it all up into this like one last major question, at least from Maher and I, then we'll transfer it over to the audience for any questions. Um, what does your average day look like, and about how many patients do you think you see per day?
So currently the average day, I really don't have an average day. We go in on, and we do round on specific days. So we have a set number of people we might see, and that it's not very many. It could be 4. And then we also have long-term patients that we have to take care of. And then on top of that, we just have to kind of go through and take care of any other issues that arise. But when you're in a clinic, your average day is you come in, you look at your schedule, and you get going. You always have your chart notes to finish. We all have that to do. Chart notes, prescription refills, review labs. So for me, my day is 8:30 to 5, and I was having to take call, but we've changed that now, so I don't have to do second call, so I hardly ever get called. But sometimes where I worked before in the nursing home, I'd had call every 3rd week and weekend. So, there's the pluses and minuses on that.
Yeah, I definitely agree. All right, now let's move on to some pre-submitted questions. And if the audience has any questions, they can always type it into the chat. So the first pre-submitted question we got was, what are the most common procedures you do every day in your day-to-day life?
Procedures. We do procedures in the nursing home, and it's during wound rounds. So common ones would be debridement, so taking off dead skin. We will do some INDs, so like abscesses, and just wound care. That's what I do, the common ones now. In the ER, it was suturing was probably the most common one that the PAs, they actually want the PAs where I work to do all the procedures, like all the suturing, the lacerations, the INDs, because that takes a lot of time. And so it freed up the physicians to do other things.
All right, the next pre-submitted question we had was, have you ever worked an overnight shift? And if so, how did it go?
I have never worked as a PA in an overnight shift, except being on call. But as a PA student, we had to stay overnight for surgery, and it was hard. And but I know there are some, especially in emergency departments in more rural areas, that you're on call. I mean, you work for like 24 or 48 hours. You just stay right at the hospital and take care of anything that comes in. And I think that could either, it could be very slow and you could probably get a lot of sleep, or it could be terrible and you'd be up for 2 days.
All right, I've received a couple private messages regarding questions from the audience. So, anonymous user wants to ask, was PA school difficult for you?
Um, I mean, I had to study. I actually had a job that I worked. So I was a physician. I was a medical technologist before I went to undergrad for medical technology, which means a lab tech. So I worked as a lab tech for 5 years, and that's actually how I got exposed to PA, because I worked evenings and we would run the lab test, but we'd also have to run and draw the blood. And they had PAs that worked in the ER. So whenever we would, had to go over there and do lab draws, that's where I got my exposure. So I forgot the question. What was it?
Yeah, it was PA school a
Oh,
difficult
yeah.
experience?
Yeah. I mean, you have to study. My second, I think my first year, I mean, I worked every other weekend in the lab. That's how it came up. Yeah. I worked every other weekend in the lab, but during the week, I studied every night. And on those weekends that I didn't work, even the ones I worked, I studied when I got home. But it was a while ago. It didn't kill me, obviously, but it was challenging. It was harder than undergrad.
Oh yeah, yeah, I could imagine. Apparently PA school is also a pretty difficult procedure, or not procedure, sorry, experience. But like you mentioned, like if you stay focused, if you get your work done, then I think you'll be good. So another private message from someone, I guess they also want to be referred to as anonymous. So anonymous is asking, when you're on call, what do you do, and what's like the exact, method or like pastime you do when you're on call?
So when I was on call, you have to carry your phone, and there's a private texting that we use, a secure chat, and they would secure chat me either lab results, or they would tell me I don't know, somebody's got abdominal pain, and then I'd have to respond or decide what to do, or if it's really urgent, they'll call me. And so you have to have your phone with you, and sometimes they would go a long time. Like sometimes I would go all night and not get any calls, and sometimes there would be a few calls. You have to do pharmacy refills. So it wasn't terrible. Sometimes they're busier than others. You just never know. But I would never have to go in for the nursing home, because they have the nurses there. I've only had to go in one time to take out something called a PIC line. That was the only time I had to go in.
Since technology has really impacted the way medical professionals work in today's day and age, how do you think technology will impact the medical field in the coming years?
Oh, wow. I don't know, but it will probably make it better. I mean, we have like bedside ultrasounds now, I think that it'll probably improve care. I mean, electronic medical records have definitely made our day longer because it takes more time to chart, but there are some things in medicine definitely that have made our lives easier too.
Yeah, I agree. I think there's been like robotic and AI surgery lately, which has made it more accurate and precise and helped save lots of lives. And someone else had a question. Any special moments when working in the lab? And I think they said they were basing it off another researcher earlier today because he had many unique experiences when he worked in the lab as well.
Well, it was a long time ago. Any unique, so I was a lab technician. So what happens is, like, if the doctor orders a CBC, you run up, well, in the evenings, we would run up, draw the blood, come back down and run the test. So, I mean, the unique situations for me is when I had to work nights and one of the machines broke. Those are the nights I remember. I had at that time the busiest night they'd ever had, and I was just like non-stop. So those are I don't know, you don't necessarily remember the great times, but definitely remember the ones that you are more stressed on, and those are the two I remember.
Yeah, that sounds kind of hectic. Anyways, I think that's our last question since we're low on time. Do you have any last words for the audience here? Like any words of advice or anything in general?
No, I really like medicine. For me, it's really interesting. I think, especially if you like to be kind of a detective in a way, because you have a problem and you have to solve it, but you also have to, for my specialty, you have to enjoy people and you have to enjoy what you do, because otherwise going to work every day is not fun. So just, good luck with all of your futures. And I hope you all find something that you really enjoy.
All right. Well, thank you so much for coming here. I think we all had a great time learning about medicine and physician's assistants. And I think everyone really appreciated your time here. So thank you for coming, and we'll see all of you guys at the next workshop, which starts in 15 minutes.
All right. Well, thank you for having me. Have a good rest of the weekend.
Yeah, you too. Bye.